My name is Dr. Brian Rogers. I'm the Director of Robotic Gynecologic Surgery at Jersey Shore University Medical Center. Fibroids are a common medical condition. Gynecologists in offices will routinely see patients that are suffering symptoms of fibroids. Symptoms can be pelvic pain, pelvic pressure, abnormal bleeding. On occasion, it can also be enlargement of the patient's abdomen. When they come in for evaluation initially, typically an ultrasound would be performed, and if there's abnormal bleeding associated with it, otherwise known as menorrhagia, endometrial sampling is also performed. Once the provider and the patient are comfortable that this is a fibroid causing their symptoms, then there are many options. There are surgical options and non-surgical options. In the surgical option category, typically myomectomies can be performed where an individual fibroid or myoma would be removed, especially in situations where women would like to desire to retain the ability to conceive in the future. For women that are no longer interested in retaining the ability to conceive, then hysterectomy is often discussed. There are various types of hysterectomy. Vaginal hysterectomy, which is the preferred method, can be performed so that there are not incisions on the abdomen. And then there are abdominal surgeries, typically an open incision called a total abdominal hysterectomy that's performed. Currently, approximately 60% or greater of these surgeries are performed with the open abdominal incision. It does allow for improved visualization, but it does make it difficult for recovery because of the pain associated with a large incision. And therefore, laparoscopic techniques, and more recently robotic techniques, have been utilized to allow the same surgery to be accomplished through small incisions. The way that can be done is that there are special instruments developed that work through these small incisions that have articulation like the surgeon's hands. So now we can move more fluidly in the abdomen. In addition, the visualization is improved. It's 3D. You can actually see in depth, and not only can you look onto structures, you can look next to the structure and behind the structure to allow for improved safety and decreased blood loss, since smaller vessels can now be visualized. Patients that undergo laparoscopic hysterectomy using the robotic technique, otherwise known as Da Vinci hysterectomy, often can go home the same day or within 24 hours. Pain afterwards is typically less. Recovery times afterwards typically less. So most patients opt for this technique if it is available to them in the community. Here at Jersey Shore University Medical Center, we're now able to offer the most advanced robotic techniques using the most advanced robotic platform called the Da Vinci SI that is offered in any community.